Hi everyone, this is Marvick Melendez, and I will be discussing safe transitions in care with home parenteral nutrition still remains a challenge. TPN is one of the most complicated infusion therapies provided at home. TPN therapies can have over 40 ingredients, and providers face multiple challenges in regard to the coordination of hospital to home, such as the PN stability, the appropriate volume, electrolyte dosing, final orders, the availability of a prescriber, nursing availability and education, all of those requiring coordination, as well as the appropriateness for the patient to be a good candidate for home therapy. All of these can change minute by minute and can affect the discharge process. Of course, patient safety should be the hallmark of any transition. And given the wide range of expertise in many of the facilities we receive referrals, the nutrition support experts in the home industry can provide a safe and seamless transition from hospital to home. So the poster that I'm presenting, we analyzed 23 data points following the 2014 Aspen safety standards for TPN, and we had a total population of 122 adults. The referrals were coming from teaching hospitals, community hospitals, acute and subacute, and rehab facilities. So the results indicated that 14% of the referrals were same day, which was great because that allowed for proper discharge planning. 94% of the referrals did have a prescribing physician identified at discharge. 95% of the referrals had good, affordable coverage for TPN. The areas which could have some improvement were that only 32% of the orders were following the 2014 Aspen PN safety recommendations. So that can definitely be improved. 25% of the formulas were not stable as 3-in-1 and required adjustment. 39% of the formulas did not have the volume adjusted for home, and about 52% of them required additional hydration besides the TPN. And 20% of the patients were not stable on the formula they were discharged on. Patients with insulin were discharged without glucometers or without proper education, and about 53% of the facilities discharging patients had a formal nutrition support team. So a couple of cases here. We cited the most notable case, which was a 69-year-old male that was diagnosed with cachexia due to gastric adenocarcinoma and was transitioned from home from a community hospital. The concerns with the formula were the following. The total volume, amino acids, and potassium exceeded the Aspen recommended doses. The formula was unstable as a 3-in-1, and the TPN was not cycled. If we cycled, the PN would exceed the maximum safe infusion. The coordinator, the nutrition support coordinator, helped working along with the clinician, hospital clinician, recommended the changes in volume, potassium, and macronutrient adjustments, which were needed for the stability as a total nutrient admixture at home. So later on, once patient was home, ongoing PN assessments were made within the couple of weeks, and patient was cycled and stabilized following Aspen recommendations. In conclusion, an expert nutrition support team needed to evaluate PN orders is crucial. In our small review, only 32% of patients discharged met the 2014 Aspen PN safety recommendations. Communication between the team and discharge clinician before discharge is best demonstrated to help prevent medication errors and safety issues, as we saw from the example of the case study. The home infusion provider can institute a communication process between the hospital clinician to review the plan of care and make recommendations for home TPN prior to discharge as needed. Adherence to national standards will help to ensure a safe transition home and can help decrease readmission status, prevent complications such as dehydration, electrolyte abnormalities, or unstable formulas. All of these, again, as the hallmark of The transition is patient safety. Thank you very much for your time.